How's it going, guys? So this is an extremely high yield question for OBGYN for 2CK. You will not pass your OBGYN shelf if you do not get this question correct. For 2CK, very fucking important, all right? So before we get started, please subscribe my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now, hopping into the actual question here, we have a 25-year-old woman. She has a 6-month history of severe menstrual pain. The pain has caused her to miss work on numerous occasions. Menarche was at the age of 13. Last menstrual period 6 days ago. Physical exam shows no abnormalities. Blood pressure 130 on 80. Questions merely asking the most likely explanation for these findings. So let's walk through the answer choices here. Choice A, endometriosis, wrong fucking answer. Now look, the value of this question is to explain to you when they want endometriosis versus not. It's too easy for 2CK questions for them to tell you findings such as OMG, pain with defecation, or dyspareunia, all right? I've seen it, of course, but they often don't mention those findings. They're too easy. So you need to know that if a woman has severe menstrual pain and she has a normal physical exam, endometriosis, wrong fucking answer, okay? They'll give you the same exact vignette, but then if they tell you physical exam shows something abnormal, it's nothing that you need to memorize as a specific finding. They could just say physical exam shows nodularity of the uterosacral ligaments. It's an abnormal physical exam. In a woman with painful periods, answer endometriosis. You're going to do diagnostic laparoscopy, okay? And you're going to treat with NSAIDs and OCPs. Definitive is laparoscopic removal of the lesions, okay? Not the answer in this case. This is primary dysmenorrhea. This is prostaglandin hypersecretion, PGF2 alpha, okay? This is what we call quote unquote normal period pain. You're going to have a normal physical exam, all right? Abnormal physical exam, endometriosis. Very high yield for OBGYN. Now also, they like you to be able to contrast ruptured cyst versus torsion. Ruptured cyst, they will give you sharp adnexal pain, no adnexal mass, and they will not mention anything about fluid in the cul-de-sac, the pouch of Douglas. In contrast, ovarian torsion, they will tell you in 4 out of 5 questions, there is colicky pain that becomes constant, okay? So they'll say she's had intermittent pain for the past 2 hours, or for 2 hours, and now she's had constant pain for the past 4. I've also seen it over the course of weeks. They can say she's had intermittent adnexal pain for a few weeks, and now she has a few hour history of constant pain. So torsion, they'll also mention a large adnexal mass. They'll say, for example, 8 by 12 centimeter adnexal mass. You're like, that sounds really fucking large. Okay, so intermittent pain that becomes constant, an adnexal mass, and they won't say anything about fluid in the cul-de-sac. In contrast, ruptured cyst, they will say just sharp adnexal pain, there's no mass, and there's fluid in the cul-de-sac, 10 to 15 milliliters of serous sanguineous fluid aspirated on cholestacentesis. Now, what can make torsion very fucking confusing is that they can say that she has a history of ovarian cyst, because a risk factor for torsion is anatomic abnormality, okay? But as I just described, you can contrast ruptured cyst versus torsion. They give you a mass, it's torsion. No mass, it's ruptured cyst. Now, pseudocyesis is a psych condition. This is the belief that one is pregnant when she is not. This is a real thing, okay? It's usually caused by a stressor such as miscarriage, okay? So a woman can go on to get what she interprets as symptoms of pregnancy, but she's not actually pregnant. This is called pseudocyesis. It's a psych condition, all right? So in short recapitulation here, if you get extremely painful periods in a normal physical exam, answer primary dysmenorrhea, prostaglandin PGF2 alpha hypersecretion, treat with NSAIDs. No further diagnostic studies indicated, okay? You don't need to do an ultrasound or anything like that. Abnormal physical exam, it's endometriosis. You're gonna do diagnostic laparoscopy. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.